Hi there. Welcome to Chapter 12 in Medical Terminology, the respiratory system, and this starts on page 460 in your textbook. And PowerPoints are available for you on Schoology and also on your screen right now. First thing the book talks about, they give an introduction about internal and external respiration, and it may not be kind of what you're thinking of. External respiration is simply the exchange of air at the lungs. So external actually happens inside our body, but it's the breathing in of the air. Everybody take a big breath in. That's inspiration, and everybody exhale all the way out. That's exhalation. External respiration is exactly what's going on at the lungs, air coming in and air leaving. The other type of respiration is internal, and that's what's going on at the cells or at the cellular level. It occurs between your cells and the little blood vessels that surround them. This is where the exchange of gases, carbon dioxide and oxygen, take place. At these little capillary blood vessels, in every body cell, oxygen passes out of the bloodstream, which, if we think back to cardiac, the heart picked up the oxygen-rich blood, took it back to the heart, sent it to the rest of the body. The oxygen passes into the tissues, and the used oxygen, or the carbon dioxide, passes from the tissue cells into the blood to go back to the heart, to leave the right side of the heart, to go to the lungs for exhalation. And then you can see how it fits all together. So external is what happens at the lungs. Internal is what happens actually in the cells, where we get that red to blue color in the cardiac representation. So the anatomy and physiology of respiration, and this also involves a really nice diagram on page 461 in your book. First of all, the flow of air, or the pathway of air, when we breathe right, we breathe in through our nose and out through our mouth. That is the most correct way to breathe. So we're going to take that path. So the air goes in through the nose, and number 1 on the diagram on page 461 over on the left is the nose. It goes in through the nose and passes through number 2, and number 2 is the nasal cavity. This nasal cavity is lined with a mucous membrane and has little tiny hairs called cilia, and cilia help filter out foreign bodies, and it also helps to warm and moisten the air before it gets into the respiratory system. Number 3 on the diagram are the paranasal sinuses, and these are the sinuses that are right next to your nose, right here. These are hollow air-containing spaces in your skull. They have a mucous membrane, and they also produce a lubricating fluid. They also serve the purpose of lightening the bones of the skull, and they help produce sound. So when you get a cold, or when you get a sinus infection and somebody says you sound very nasally when you talk, we're referring to what it sounds like when these sinuses, when the mucous membrane get inflamed, and it causes you to sound like this. Okay? After the nasal cavity, the air reaches the pharynx. Okay, so the paranasal sinuses are number 3. The nasopharynx is part of the nose and the throat. Number 5 are the pharyngeal tonsils, or the adenoids, and these are represented by green, and they're in the back of the nasal cavity in that nasopharynx area. Number 6 is the oropharynx, and that's the back of the throat. And number 7 are the tonsils that are in the back of the throat. Those are the palatine tonsils, or what we refer to when somebody has their tonsils removed. Okay, the adenoids and the tonsils are both labeled tonsils, but the palatine are the actual tonsils that we take out in the back of the throat. The adenoid are the pharyngeal tonsils at the back of the nose. So the pharynx, or throat, is divided into the nasopharynx. We labeled that. That was number 4. Also the oropharynx, that was number 6 in the diagram, and that contains the palatine tonsils, or what we refer to loosely as tonsils. And then number 8 is the third portion of the pharynx. That's the laryngopharynx. The laryngopharynx serves as a common passageway for both food from the mouth and air from the nose. If we follow the laryngopharynx, it divides into 2 branches. And number 9 on the diagram is the first branch, and that's the larynx, or the voice box. So if we look at the word laryngopharynx, we see laryngo, that means voice box, and pharynx means throat. So number 9 is the voice box, and this is where the vocal cords are located and surrounded by stiff cartilage for support. And number 10 is the other branches, or the other division of the laryngopharynx, and that's the esophagus. And the esophagus leads to the stomach and carries food to be digested. Okay, so nasopharynx, oropharynx, and laryngopharynx are all divisions of the pharynx, or the throat. The epiglottis is number 11 on the diagram, and the epiglottis is a flap of cartilage attached to the root, or the very, very back portion of the tongue, and that prevents choking or aspiration of food. We talked about this a little bit in digestion, the same concept. When you're swallowing food, the epiglottis acts as a lid over the opening of the larynx, so the food goes down the esophagus and not the larynx. If you're talking while you're chewing and eating, you may choke, and somebody may say, did it go down the wrong pipe? That's what we're talking about, the pharynx and the larynx. Okay, so during swallowing, the food and liquid go through the throat, the epiglottis closes over the larynx. Okay, so it's wise not to eat and talk at the same time, because your epiglottis gets confused of what it should be doing. And on the diagram, epiglottis is number 11. The trachea is number 12. And, trachea is number 12, also known as the windpipe. The trachea, on its way to the lungs, air passes from the larynx to the trachea. It's about 4.5 inches long and about 1 inch in diameter. Trachea is kept open by 16 to 20 C-shaped rings of cartilage separated by fibrous connective tissue that stiffen the front and the sides of the tube to keep it open so it does not collapse and interrupt airflow. And number 12 is the trachea. Number 13 on the diagram, 13 on the diagram over on the left is the mediastinum. And the mediastinum is the center of the chest, or the center of the thoracic cavity. It's the space in between the 2 lungs. And that's number 13. Number 14 over on the right is the bronchi, or bronchial tubes. Each one separately is called a bronchus. But in the mediastinum, the trachea then divides into 2 branches, and these are the bronchial tubes, or the bronchi. Each of these lead to a lung. And then the bronchial tubes, or the bronchi, divide and subdivide into smaller and smaller and finer tubes, somewhat like the branches of a tree. The bronchial tube is the trunk, and the division are the branches. And that's number 14 on the diagram. And you can see in the drawing how they branch off like that inside of the lungs. And number 15, it represents the lungs. And inside those lungs, the smallest bronchial tubes are the bronchioles. And if we break that word down, O-L-E means little or small, so little or small bronchi. At the end of each bronchiole are clusters of air sacs, and these are called alveoli. Or if it's singular, we're talking about just one, it's the alveolus. This very thin, each alveolus is lined with a 1-cell layer of epithelium, so a very thin tissue layer. And this is very thin, so it lets the exchange of gases happen in the capillary surrounding it, oxygen and carbon dioxide. So blood flowing through the capillary accepts the oxygen from the alveolus while depositing carbon dioxide into the alveolus. And erythrocytes are the blood cells that are responsible for carrying oxygen to all parts of the body, and also responsible for picking up that carbon dioxide and taking it to the lungs for exhalation. Oops. Okay. I hit a button, I'm sorry, but we'll get back at it. Okay. The lungs, and this is number 15 on the diagram. The lungs are covered by a double-folded membrane called pleura. And like the heart, the outer layer of the pleura, or the one closest to the ribs, is known as the parietal pleura. And the inner layer, closest to the lung, is known as the visceral pleura. How I remember that is the outside is pretty like a present. So parietal is present. And the visceral is the very good stuff inside, and that's the V for visceral and V for very good. And that's the side that is laying right on the lung tissue. Like with the heart and the pericardial membrane, the pleural membrane has a serous secretion that moistens it and facilitates movements of the lungs within the chest. So when the lungs expand and when the lungs deflate, they don't stick to themselves and they don't stick to the chest wall or to the ribs because they're always kept moist. If you look at number 16 on the diagram, we talked about the alveolus or the air sac. That's number 16 is a terminal bronchiole or the small bronchus. And 17 is showing a cluster of air sacs or the alveolus. And each bronchiole is lined with alveoli or an alveolus around it. And you have about 300 to 400 million of these in each lung. Again, number 18 on the left is a capillary, those red blood cells that drop off oxygen, pick up carbon dioxide. And number 19 are the erythrocytes, and those are your red cells. Capillary is the thin wall that permits the exchange of the gases. The parietal pleura is number 20 on the diagram, the outer layer, the present or the pretty part. And number 21 is the visceral pleura, or the inner layer or the inner membrane of lining around the lungs. And that's number 21 is visceral pleura. If you look at the lungs, and remember the right side is actually your left and the left side is actually your right because the patient is in the anatomical position. But if you look at the lungs, the lung over on the right, and these are labeled right and left for us, is a little bit bigger than the left lung. And the right lung has 3 lobes. How many does the left lung have? 2. We can take out an entire lobe of a lung without doing any damage to the rest, and the lung will function close to what it did before we took the lobe out or before we did a lobectomy. The uppermost portion of the lung is the apex because it's pointed, and the lowermost portion of the lung is known as the base because it's broad. Any part of the organ that is more pointed is referred to as the apex, and any part that is more broad is always the base. And I think you will see that on the test. So the apex is the top or the pointed part, and the base is the broad part. Why is the left lung a little smaller than the right lung? Well, if you look there's a picture right in the middle in the mediastinum. There's the heart, and that's shifted slightly to the left. So we have to have space in there for that organ, so the left lung is slightly smaller than the right lung. The midline region where blood vessels, nerves, lymphatic tissue, and bronchial tubes enter and exit is known as the hilum. And we talked about that with the kidneys, okay, where the bronchial tubes enter and leave, and where blood is supplied from is always the hilum. It's usually a notched area in the organ. The next thing to label on the diagram is the diaphragm, and that's number 22. And your lungs take up your entire thoracic cavity, actually. They extend from the collarbone or the clavicle down to the diaphragm. And the diaphragm, number 22, is a muscular wall or muscular partition that separates the thoracic and abdominal cavities. The diaphragm is what helps us to breathe. Contraction and descends with each inhalation, and the downward movement enlarges the thoracic cavity, decreasing the internal air pressure in the thoracic cavity, so air can't help but flow into the lungs because the body is always wanting to equalize the pressure. So everybody take a big breath in. That diaphragm pushes down, enlarging the thoracic cavity, so then air is taken into the lungs to equalize that pressure when it's out of balance. When your lungs are full, the diaphragm then relaxes. That muscle relaxes and raises up or elevates, making the area in the thoracic cavity small, increasing air pressure and in the chest. And then to equalize that pressure, then we exhale. Air is then expelled out of the lungs to equalize the pressure, and this is what we call exhalation. And if you look on page 463, they have a really good picture of inhalation or inspiration and exhalation or expiration. Okay, diaphragm contracts and then diaphragm relaxes. And the whole lung filling up and getting rid of air all has to do with keeping that pressure in the thoracic cavity even. If you look at the pathway of air on 463, we have the nose, the nasal cavities, and the paranasal sinuses, and the pharynx, which is the throat, the larynx and trachea, which then split off to become the bronchi and bronchioles in each lung. Alveoli are those air sacs in each lung. This is where the exchange of gases takes place. This is when you inhale, you pick up oxygen. When you exhale, you get rid of carbon dioxide. And the lung capillaries take that blood back to the heart so it can be distributed to the entire body. And you do this, you breathe about 16 to 20 times a minute on average. Babies breathe much faster. The average rate of breathing for a newborn is anywhere from 40 to 60 breaths a minute. All of us breathe about, maybe 12 to 16, 12 to 20. Okay, as we age, it slows down. Okay, so what I would like us to do is to turn to page 487, and I'm going to have you push pause and go ahead and go through letter A. There are 15 anatomic structures that we just talked about, along with a really brief description. Go ahead and match those up. You can press pause and do that, and we'll go through those. Okay, welcome back. Let's go through these. Number one, the outer fold of the pleura lying closer to the ribs, so inside, that would be the parietal pleura. Number two, the collections of lymph tissue in the nasopharynx, so in the very back of the nose, where the nose and the throat come together. Those are the adenoids. Number three, another word for windpipe is trachea. And that lid-like piece of cartilage that covers your voice box, number four, that's the epiglottis. That little flap that keeps air going down the trachea and food and liquids going down the esophagus, and hopefully never the two shall get mixed up. You don't want to aspirate and get fluid in your lungs. Number 5, branches of the windpipe that lead to the lungs are the bronchi, or bronchus if we're talking about just one of them. And number 6, that region right in the middle of the thoracic cavity or the chest cavity, right in the middle between the lungs, is called the mediastinum. Number 7, air-containing cavities in the bones around the nose. So those hollow portions of the skull are the paranasal sinuses. And paranasal sinuses, or the nasal canal, are all lined with a mucous membrane with little bitty hairs. Those hairs are called cilia. Hello. Oh my goodness, hold on, I don't know how to shut this off. Give me 1 second. Okay, sorry about that. Number 9, inner fold of pleura closer to the lungs, so the inside, that's the visceral pleura. The throat is also known as the pharynx. Air sacs of the lung are known as alveoli. The voice box is known as the larynx, and those terms I want you to be able to recognize that the pharynx is the throat, the larynx is the voice box, windpipe is the trachea. I'd like you to recognize the medical term and the layman term for those as well, be able to match those up. The smallest branches of bronchi are bronchioles, and the lymph tissue in the oral pharynx or the back of the throat are the palatine tonsils, or what we refer to as tonsils. And the midline region of the lungs, where bronchi, blood vessels, and nerves enter and exit the lungs, is the hilum. All right, good job. So let's look at some combining forms. And these are start on page 465. We have 34, or somewhere around 34 or so, word parts. You've seen some of these already, but some of these are new. So let's go ahead, and these are what you're going to make your cards for. The first one on 465 is adenoidal, and that means adenoids. Adenoidectomy would simply be removal of the adenoids. And if we said the patient had adenoid hypertrophy, that would be excessive growth of the adenoids. Sometimes we remove the adenoids because they hypertrophied or are enlarged. 1 second. Okay, sorry for the brief interruption. Alveolo means alveolus, or those air sac around each bronchiole. You have about 300,000 of them in each lung. Alveolar will be pertaining to the alveolus, or the air sac. Broncho and bronchio both mean bronchial tube or bronchus. Bronchospasm would be a tightening of the bronchus. It's when the bronchus constricts suddenly and without warning, and it's a chief symptom, or the chief indicator of asthma and bronchitis. Bronchiectasis is just the opposite. It is expansion or dilation of the bronchus. Bronchodilator is a chemical or a substance that dilates or opens the bronchus. An example of a bronchodilator is albuterol, and we do this either through an inhaler or we use it during a nebulizer treatment. Bronchopleural means pertaining to the bronchus and the pleura, that double-folded membrane around the lungs. Bronchiolo means bronchiole, or the smallest of the bronchus. Bronchiolitis is inflammation of the bronchioles. This typically occurs in children under 1.5 years old, and it is a viral infection. Capno means carbon dioxide. Hypercapnia means condition of excessive carbon dioxide in the blood. Conio means dust. Pneumoconiosis, break the word down. Osis means abnormal condition. Pneumo means lung, we'll get to that in a moment, and then conio is dust, so abnormal condition of dust in the lung. Page 466, cyano, you've had that one already, it means blue. Epiglottal, you've had that one already as well. That means epiglottis. Laryngeal, we've also had, it means larynx or voice box. So laryngeal will be simply pertaining to the voice box, and laryngospasm would be a spasm of the muscles that close the larynx. Laryngitis is inflammation of the larynx. Somebody has laryngitis, they've lost the ability to speak. So when you're sick and a sore throat and when you talk, you can only whisper. That's because you have laryngitis. Lobo means lobe of the lung. 3 lobes on the right, 2 lobes on the left. A lobectomy is simply a removal of a lobe of the lung. And there are different degrees of a lobectomy. If you look down on 466, letter A is a wedge resection, and that's taking out a small localized area of tissue near the surface or the outside of the lung. There are no bronchioles or nothing like that involved. It's just a chunk of lung tissue. Letter B goes a little bit deeper. It's a segmental resection where we take a removal of a bronchiole and its alveoli, and it can be one or a couple of these. The remaining tissue then expands to fill the previously occupied space, so the lung kind of regenerates itself. It doesn't regenerate bronchioles, but it does regenerate lung tissue. Letter C is a typical lobectomy, and that's a removal of an entire lobe. After a lobectomy, the remaining lung increases in size to fill the space in the thoracic cavity, so that lung tissue regenerates itself. Again, the bronchioles don't regenerate. Once we take those out, those are gone, but the tissue regenerates, so the pressure inside the thoracic cavity remains relatively unchanged. And it takes time, obviously, for this tissue to regenerate itself to take up that space, but eventually it will do that. And letter D is a pneumonectomy, and that's a removal of an entire lung. Techniques such as removal of the ribs and elevation of the diaphragm to take up that space kind of help even out the thoracic pressure. The lung obviously can't renew itself from nothing, so once we take the lung out, we have to do some changes to the we have to do some construction changes in that thoracic cavity and lift that diaphragm up, take ribs out depending on the structure of the patient. That'll be up to the surgeon, but we need to do as much as we can to help that pressure regulate itself. Mediastinal means mediastinum, and that's the area between the lungs. A mediastinoscopy, scopy means to visually examine. So it's a visual examination of the mediastinum using an endoscope. Nasal means nose. Paranasal sinuses are the sinuses surrounding or around the nose. Nasogastric intubation. Intubation means to put a tube into. If we look at nasogastric, IC is pertaining to, naso is nose, and gastro is stomach. So with nasogastric intubation, we're putting a tube through the nose down into the stomach. Ortho means straight or upright. Sorry. Orthopnea. Pnea is a suffix for breathing. And if we haven't had that, I think we have. But if we haven't had it, we'll have it a little bit later. Orthopnea means the person has to be upright in order to breathe. If somebody has orthopnea, they can't sleep laying flat on their back. They either have to go to a recliner or prop themselves up with multiple pillows. That's when somebody has orthopnea. Oxo means oxygen. You've had that one already. Hypoxia would be IA is condition of low oxygen in the tissues. Pectoral means chest. You can put on the same card as thoraco for chest. Expectoration is the stuff that gets expelled or comes from the chest. So if somebody has secretions in the airway or secretions in the lungs and they cough it up or we suction it out, that's called expectoration. Pharyngeal means pharynx or throat. Pharyngeal is pertaining to the throat. Phono means voice. And you use your voice when you use your phone, unless you're texting or something else, but typically you use your voice when you're on the phone. The word dysphonia means a condition of difficult voice, difficulty with the voice. An example of dysphonia would be being hoarse, hoarseness, or other voice impairment. Phreno means diaphragm. Phrenic nerve is a nerve that supplies the nerve supply to the diaphragm. And this is a motor nerve that causes movement. Pleuro means pleura, that double-folded membrane around the lungs. Visceral pleura is on the inside or closest to the lung. The parietal pleura is on the outside, the one closest to the ribs. Pleurodynia, the suffix dynia means pain. So pleurodynia is pain of the pleura. When somebody takes a big breath in and they have sharp pain in their chest, typically that's caused by pleurodynia or inflammation of the pleura. And then pleural effusion, the word effusion means escape of fluid from blood or lymph vessels. So a pleural effusion is an escape of fluid into the pleura space or in between the membrane surrounding the lungs. Page 468, pneumono and pneumo both mean air or lung. Pulmono also means lung. I would put those on the same card. Pneumothorax, thorax means chest. So pneumothorax means air in the chest. If there is damage or a hole or a perforation of lung tissue, the air will accumulate in the chest cavity. And that's called the pneumothorax. When the air accumulates outside of the lung, that changes the pressure in the thoracic cavity, and the lung can't inflate. So after a pneumothorax, what comes next probably is a collapsed lung, because there's no room for expansion because the air is taking up the space that the lungs should be taking up with inhalation. A pneumonectomy, we saw the picture of that on the last page, a removal of an entire lung. Pulmonary means pertaining to the lung. Rhino means nose. Rhinoplasty, plasty means surgical repair, so surgical repair of the nose or a nose job. And then rhinorrhea, discharge from the nose, or what we know as a runny nose. Sinuso means sinus or cavity. Sinusitis is inflammation of the sinus cavity. Spiro is a new one. It means breathing, just like the suffix pnea means breathing. Spirometer, meter means an instrument to measure. So a spirometer is an instrument to measure breathing. Expiration. Expiration is the act of breathing out. X means out. And we take off the X in spiro because an X and an S together doesn't make sense. So that's why the S in spiro is taken out of that term. And then respiration, means again or back. And respiration is a process of breathing again. So an inhalation and an exhalation together, or an inspiration and expiration together, make up one respiration. They talk about Cheyne-Stokes respirations, and maybe you've heard of these before. These are marked by rhythmic changes in the depth of breathing, where the patient, and this is usually near end of life, where the patient will breathe fast or very shallow, and then they may have an absence of breathing. And this pattern can occur every 45 seconds to a couple of minutes. And then they'll breathe again, and they'll get shallow. They'll take a big breath, and then there may be an absence for up to a couple of minutes. Okay, and during this, heart failure can result, or brain damage can result, and usually this is part of the dying process or end of life. 469 has tello. Tello means complete. So atelectasis. Okay, atelectasis is condition of without complete expansion. And another word for atelectasis is collapsed lung. There's a picture of a collapsed lung on 469. And you can see there's fluid in letter B, or air, and that's shown by the yellow. And the lung can't expand, so we call it a collapsed lung, or atelectasis without complete expansion. We've had thoracal for chest. Thoracotomy is to cut into the chest. And thoracic would be pertaining to the chest. Tonsillo means tonsils. A tonsillectomy is a removal of the tonsils. And when we use the word tonsil, we're talking about the pharyngeal or the palatine tonsils in the back of the throat. Tracheo means windpipe or trachea. Tracheotomy is to cut into the windpipe or trachea. And tracheal stenosis is abnormal narrowing. Stenosis is abnormal condition of narrowing. Let's do a few suffixes. Ema means condition. Empyema, M in this term, the prefix M means N. Pio, we've had this before, it means pus. So empyema means a condition of pus within. Okay, empyema is a collection of pus in the pleural cavity. There isn't a part of that word that makes you think of chest, but empyema, that's technically what it means is pus in the pleural cavity. The suffix osmia means smell. Anosmia would be condition of without smell or no smell. Sometimes when you're sick and you have a cold and your nose is severely stuffed up, you have temporary anosmia because you can't smell anything. And because you can't smell, there's issues with tasting as well. The suffix pnea, like the combining form spiro, means breathing. I would put those in the same card. So apnea, condition of not breathing. Sleep apnea is a sudden cessation of breathing while the patient is sleeping. It can result in hypoxia or low level of oxygen in the tissues, leading to cognitive impairment, hypertension, and arrhythmias. What do we do with people who have sleep apnea? Well, we have CPAP machines, and that acronym stands for continuous positive airway pressure. And it's a gentle ventilatory support used to keep the airways open. And the one on page 470 is one that goes over the nose, and it's constantly pushing air into the nose to keep the airway open. Okay, I'm a patient who has a sleep apnea machine or a CPAP. I thought about doing a lecture with my CPAP on, but it would be scary, so I decided not to. Okay. Dyspnea is the next word, and that means difficulty breathing. Difficult or abnormal breathing. Hyperpnea means, hyper means excessive breathing, and this is an increase in the depth of breathing, where if somebody gets emotionally upset and they start to breathe really, really, really deep and you think they're going to hyperventilate, that's because of hyperpnea. Tachypnea has to do with the rate or how fast they're breathing. Ptysis means spitting. So hemoptysis describes somebody who's spitting up blood. Asphyxia means pulse. Asphyxia means condition of no pulse. And thorax, like thoraco, the combining form, or pecto, the combining form, they all mean chest. I would put those all in the same card. So pyothorax means there is pus in the chest. And hemothorax means there's blood in the chest cavity. So those are our words for respiratory system. Now I want to talk about some diagnostic terms and some pathological conditions. Again, she has a lot and a wealth of information, and it's all very good. I want to tell you the ones to focus on, though, for testing. The first one for diagnostic terms on 471, I want you to mark as auscultation. And auscultation means listening. Listening to the body sounds within the body. Typically, we use a stethoscope for auscultation. Percussion. And that's a tapping on a surface to determine the difference in the density of the structure that lies underneath. Tapping a solid organ produces a dull sound without resonance, and percussion over an air-filled structure produces a resonant or hollow note. So if we're doing percussion and the physician is tapping on the different lobes of the lung, if it sounds different from the upper lobe to the lower lobe, there may be some fluid in there or some pus or an infection. So auscultation and percussion. Go ahead then and mark sputum. Sputum is material expelled from the bronchi, lungs, or upper respiratory tract by spitting. That's sputum. If it's pus containing, it's called purulent. Also then mark, and I have them listed on the thing, but only mark the ones that I'm telling you to highlight or to mark or to note. The next one, or the fourth one on this page, I want you to mark is wheezes. And wheezes are a continuous high-pitched whistling sound that are produced during breathing. Patients with asthma or emphysema commonly experience wheezes as those bronchi, or those bronchial tubes, tighten and narrow. So the air has to be forced through. When you force through, it makes a sound or a wheezing sound. Okay, page 472, I would like you to mark croup, and that's an acute viral infection in babies and children with obstruction of the larynx or the voice box, and this is accompanied by a barking, cough, and stridor, or difficulty inhaling. Epistaxis is another word for nosebleed. Asthma, mark that one as well. Chronic bronchial inflammatory disorder with airway obstruction due to a couple of different things. The first one is bronchial edema or swelling. So the mucous membranes swell up, so there's interrupted airflow. Also, constriction of the bronchioles, so they become smaller. And with the edema comes mucus production, so there's like a 3-for-1 there. They get swollen, they produce a bunch of stuff or mucus, and they also constrict, which is why with asthma we hear wheezing, because the air is really working through these 3 components to get in and out of the respiratory tract. Next page, I want you to mark atelectasis, which means collapsed lung or incomplete expansion of the lung. Page 474, mark pneumoconiosis, and that's abnormal condition caused by dust in the lungs. Results in chronic inflammation, infection, and bronchitis. (476) mark pulmonary embolism or PE, and this is a clot or other material that lodges in the vessel of the lung. And remember, an embolism is simply a clot that gets feet and travels around. The clot travels from a distant vein, typically but not always, from the legs or the lower extremities. Occlusion can produce an area of dead tissue or necrotic tissue. And there's a picture of a pulmonary embolism in the drawing on letter A in the bottom of 476. And there's also a picture of a true clot that it was a fatal incident in a patient, and there it is lodged in the bronchial tubes in a lung. Also mark tuberculosis or TB, infectious disease caused by the Mycobacterium tuberculosis. Lungs are usually involved, but typically any organ of the body can be affected. It likes the lungs the best, but it can affect any internal organ. And TB is what we screen for when we work in healthcare. It's what we screen for every year by doing the TB skin test, or that little test where they put that medication under the skin and you have a little bleb and you have it read in 48 hours. And usually it's an annual or an every other year thing, depending on your facility. Page 477, pneumothorax. That's a collection of air in the pleural space. And this word, pneumo, means air, and thorax means chest. 478, mark chest x-ray. This is a radiographic image of the thoracic cavity. We take them in the frontal or coronal plane, looking from the front to the back of the body. as well as posterior, anterior, so from the back to the front, and also the sagittal plane as lateral views. So we take it from the front looking to your back, we take it from the back looking to the front, and then we have you stand sideways and we have you raise your arms up and we look at the lungs that way as well, or the chest that way as well. Normal chest x-ray is letter A on the bottom of 478, and everything is labeled for us, but that looks like a normal chest x-ray. Letter B, if you see the lower lobe of the right lung, it's white. That means there's stuff in there. If it's just air, we can see through it, and we can see the front and the back of the ribs. Letter B, the right lower lobes, looks like a pneumonia. Page 479, bronchoscopy. Fiber optic endoscope examination of the bronchial tubes. Scopy is to visually examine. Broncho means bronchial tubes. Picture of a bronchoscopy on 479 up at the top. We have the endoscope that goes all the way down through the mouth, oropharynx, down into the trachea, into the windpipes, into the bronchus. Endotracheal intubation on page 480. Placement of a tube through the mouth into the pharynx, larynx, and trachea to establish an airway, either before a procedure or a surgery, or during an emergency to establish emergency airway. And there's a picture of that happening as a side view on page 480. A laryngoscope is used to hold the airway open and expose the vocal cords so the tube can be placed in the correct spot. A lung biopsy is a removal of lung tissue followed by a microscopic examination. And then thoracentesis, page 481. Centesis, remember, is the surgical puncture to remove fluid. So this is from the chest or from the pleural space. Letter A shows how the patient would be positioned. We usually have them on the bed. A pillow in front of them, leaned over, probably a side table put to the right, depending on the height of the patient. Exposing the area where we're going to insert the needle. They go into that pleural effusion or collection of fluid, and they pull that off. And then we can culture it, or whatever the physician orders. Thoracotomy is a large incision of the chest. Tomy is to cut into. Tuberculin test on page 482 as well determines the past or present TB infection based on a positive skin reaction. We're not testing for the disease when we do a TB skin test. We are testing for the antibodies that are hiding in your body. And all that tells us is you are now or have been sometime in your life exposed to the tuberculin pathogen. All right, some abbreviations I want you to mark. I want you to mark on page 483, carbon dioxide, COPD, CPAP, CPR. The next column, mark chest x-ray, LLL for left lower lobe, LUL for left upper lobe, O2 for oxygen. Page 484, mark PE for pulmonary embolism. PFTs for pulmonary function tests. PPD for purified protein derivative. This is what we use when we do the TB skin test. RLL for right lower lobe. And RML for right middle lobe. RUL for right upper lobe, and we're referring to the lungs, obviously, with these abbreviations. SOB doesn't mean what you think, it means shortness of breath. TB, tuberculosis. So those are our word parts and our disorders and our pathology testing, our x-ray testing for the respiratory system. Make your cards out, study them a little bit every day. Don't try to cram it all into one study session. Try to kind of spread those out. The test will be available for you through Schoology. If you have any questions or anything about this lecture or about the class when we're kind of transitioning to doing it this different way, please let me know. You can call me, home phone, cell phone, email me, or text me. I'm reachable anyway. And I hope things are well, and thank you so much. We'll see you next time.